There's some very good news out of the UK this morning, where an old and cheap steroid has been found to be the first life-saving treatment in the COVID-19 pandemic.
Scientists in the UK have announced the major breakthrough after finding the steroid, Dexamethasone, can save the lives of the most seriously ill patients. Europe correspondent Sam Hawley reports.
What a breakthrough. An old, readily available steroid costing around £5 or $10 is saving lives.
So in ventilated patients with COVID-19, the drug dexamethasone, so 10 days of treatment with that, which is a tablet or an injection, reduces the risk of death by about 35%. In patients on the ward who require oxygen and have COVID, it reduces the risk of death by about 20%. That covers about 75% of patients in the hospital who will receive a mortality benefit from using this drug. So we've looked at the numbers, and if we treat 8 patients in intensive care with this drug, we'll save 1 life. And the total cost of treating all 8 patients is only about £40. So this is really, really remarkable.
But I am proud of these British scientists, backed by UK government funding, who have led the first robust clinical trial anywhere in the world to find a coronavirus treatment proven to reduce the risk of death.
The death toll in the UK, according to the government, is around 42,000. But new national statistics show it's far greater than that, at around 53,000, with a third of all those deaths occurring in care homes. Scientists say this drug will reduce the number of deaths going forward.
I think the investigators in this study have actually said that if this had been available even in the UK and used in the way that they've used in the study, right from the start of the sort of epidemic here, could have saved 5,000 lives. So imagine the numbers around the world that could be saved.
The good news for the government is dexamethasone is widely available. It's thought 200,000 doses are ready to go in the UK alone.
Jessie Dorsett joins us now from Sydney with more. Good morning, Jessie. What can you tell us about this drug we've been talking about this morning?
G'day Lisa. Dexamethasone is a cheap and widely available drug, and it's really exciting researchers in the UK who have been looking at existing treatments to see if they'll also work for coronavirus. They say that it could cut the death rate by 1/3 for people on a ventilator and by 1/5 for patients using oxygen. The scientists say that the anti-inflammatory steroid could have saved 5,000 lives in the UK alone if it had been used from the start of the pandemic. The British government says that it will make the drug available to patients from now on. And no doubt authorities here in Australia will also be looking very closely at the results of that, because dexamethasone is available here via prescription at most pharmacies.
Yeah, right. Well, we're going to be talking to the head of the New South Wales branch of the Royal Australian College of GPs very shortly, so we'll ask her about that. Meanwhile, yesterday we were talking about those double-figure numbers of cases that had cropped up in Victoria. What's the tracking looking like for the last 24 hours?
12 new cases across Australia, Lisa. Victoria just missed out on the double figures, which is good. 9 new cases yesterday. One was a year 5 student in Melbourne's north, and 2 new infections linked to a previously diagnosed patient at Monash Health. In Victoria, there are now 6 people being treated for coronavirus in hospital, 2 in ICU. More than 1,600 people in the state have recovered. And here in New South Wales, there were 3 new infections yesterday. All were returned travellers in hotel quarantine.
And New Zealand had been doing so well for so long. What was it, 3 weeks or so without a case? What happened?
24 days, Lisa, without any new infections. That ended recently when 2 women travelled from the UK to Wellington to attend a funeral. They transited in Doha and Brisbane. New Zealand has now changed the rules, so anyone who wants to leave quarantine for compassionate reasons must test negative for coronavirus.
All right, Jessie Dorsett, thank you.
Fears of a second wave of coronavirus in China are ramping up, forcing authorities to tighten restrictions. All schools in the Chinese capital, Beijing, have been ordered to close again to contain a fresh outbreak. And residents have also been ordered to stop all non-essential travel out of the city. After nearly 2 months of no local infections, there have been more than 100 new cases, all linked to a wholesale food market.
There have been reports this week that some people are getting tested to prove to their bosses that they don't have the virus, with some demanding testing certificates. For more, the New South Wales chair of the Royal Australian College of General Practitioners, Dr. Charlotte Hespe, joins me now from Sydney. Good morning, Doctor. Welcome to breakfast.
Good morning, Lisa.
Look, could I just start actually with this breaking news that we've been covering this morning on the program about this drug that seems to be widely available, Dexamethasone. What do you know about it? They're saying that it could actually help keep COVID patients alive.
Dexamethasone is a very long-standing and widely used medication in medical circles. What it is an anti-inflammatory, essentially. It's a steroid. It's in the same family as prednisone, which many people might recognise the name of. And it's well known to be used in intensive care circumstances to decrease swelling and inflammation. It would probably appear that the dexamethasone is being used to decrease what we call the cytokine crisis, as well as the inflammation in lungs and other parts of the body affected by COVID, which has then got the wonderful effect from the study numbers that have come out this morning to have a decrease in the death rate for those on a ventilator from sort of 4 out of 10 dying down to 1 in 5.
Yeah, OK. Well, we'll keep following that throughout the program because certainly sparking a lot of interest. While we don't have a vaccine yet, events like this and news that there are drugs that could help those who have COVID are certainly very welcome. Doctor, could I turn to the issue at hand this morning, which is this idea that employers or bosses are saying that you've got to have a clearance, you've got to prove you're negative before you can come back to work. What are you hearing from people? What's going on out there?
Yes, there's this sort of nonsense that a GP is being asked to provide a certificate of clearance, which is basically they're asking for a guarantee that this any individual, so say you, Lisa, you've been unwell, your ABC says you can't come back until you actually are proven to not have COVID-19. GPs and the RACGP are saying that is a nonsense. We can certainly say you have a negative COVID test at any one point in time, but from then onwards, we can't guarantee anything. What we really would like bosses and employers and all Australians to continue to do is to say, stay away from work when you have any symptoms. Immediately go home, get testing, go and see your GP. We can organise for you to have testing to prove that it isn't COVID at this point in time, so we can check where there's community spread, and then continue in the workplace to ensure social distancing and good hygiene. In terms of return to work, really we just need to be pragmatic and sensible. People should not be returning to work until they have no symptoms that are infectious anymore. And that's really up to the individual to be able to be honest and acknowledge that they are ready to be able to return to work. GPs can provide a letter to say you've had a negative test, that you no longer have symptoms, but we cannot give a clearance certificate. And from what I'm hearing, there's also been, as you sort of alluded to, people being asked to, with no symptoms, go and get a test to say that they are COVID clear. Again, what a complete nonsense. This test is good for picking up, it's sensitive to pick up the presence of COVID-19, but if you are even in the first day or two of having been exposed to and potentially having an infection, the test is going to be negative. So there's a false assurance if someone's actually been exposed or at a time when they're not actually yet got enough of the infection to be able to be picked up as positive.
Yeah, you could be negative.
We don't want that.
Yeah, you could be negative one day and not negative the next. So it is, I can see how you say it's meaningless. While I've got you, can I just ask you, we were all very concerned about the caseload that GPs might be facing at the beginning of this pandemic, but then we got the telehealth consultations approved. How are GPs getting on now there's concern people are still thinking, well, I won't go and get stuff checked out because the doctors are all going to be busy?
Great question. Thanks, Lisa. It's been a really weird world. The disruption of COVID for everybody has been really difficult, and for GPs in particular, the turnaround rapidly to doing, a normal business, which is always face-to-face, into a telehealth. And can I say it's mostly been telephone, even though from my perspective, I would prefer if we're doing telehealth, it would be face-to-face and video consults. Has been really difficult for everybody. There's been a real tendency for people to be afraid that they may be more exposed to illness going into a doctor's surgery, so telehealth was great about keeping people away. But also, people have just been thinking, I'll do it afterwards. But the afterwards is a long way away. We actually need everybody to understand GPs are there now to look after you all the way through everything. We're particularly wanting to make sure that diseases, illnesses, sort of cancer prevention, all of the normal work of our business can continue for everybody now. We can do that through telehealth, and we can also do it through face-to-face safely when people are appropriately screened.
Yeah, look,
so
great.
It's just that difference in how we deliver the business.
Yeah, great points. Thanks very much, Charlotte Hespe, for coming on this morning. Really appreciate it.
Thanks, Lisa.